Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Treatment without hormone blockers helps solitary prostate cancer metastasis. For patients with solitary metastasis from prostate cancer, an approach called metastasis-directed therapy or MDT can slow the time to cancer progression, reported a study in the Journal of Urology. MDT-focused treatment using surgery or radiation therapy without androgen deprivation therapy or ADT. Metastasis-directed treatment has emerged as a potential alternative for men with oligorecurrent prostate cancer, a state of disease with a limited number of metastatic lesions after initial treatment. In the MDT approach, surgery or radiation therapy is used to specifically target the area of cancer spread. That's in contrast to ADT, systemic therapy to block testosterone and other male sex hormones, which promotes the growth of prostate cancer. Androgen deprivation therapy with or without other systemic therapy is the standard treatment for metastatic prostate cancer, but has numerous adverse effects that can decrease quality of life, including sexual dysfunction, bone thinning, and loss of muscle strength, among others. If MDT is effective in controlling limited recurrences, it may avoid or delay the need of ADT. Recurrent COVID-19 infections may heighten chances of organ failure and even death. A new study from Washington University School of Medicine in St. Louis and the Veterans Affairs St. Louis healthcare system shows the health consequences of reinfection with SARS-CoV-2. The researchers found that repeat SARS-CoV-2 infections contribute significant additional risk of adverse health conditions in multiple organ systems. Such outcomes include hospitalization, disorders affecting the lungs, heart, brain, and the body's blood, musculoskeletal and gastrointestinal systems, and even death. Reinfection also contributes to diabetes, kidney disease, and mental health issues.
Dementia prevalence is declining among older Americans, study finds. In 2021, about 6.2 million US adults aged 65 or older lived with dementia. Because age is the strongest risk factor for dementia, it has been predicted that increasing life expectancies will substantially increase the prevalence of Alzheimer's disease and related dementias from about 50 million to 150 million worldwide by 2050. The prevalence of dementia in the US is declining among people over the age of 65, dropping 3.7 percentage points from 2000 to 2016, according to a new RAND Corporation study. The findings are published in the latest edition of the journal Proceedings of National Academy of Sciences.
Light physical activity linked to alleviated symptoms of intracerebral hemorrhage. 4 hours of light physical activity per week can now be linked to milder symptoms from intracerebral hemorrhage and also to better survival rates, a University of Gothenburg study shows. Intracerebral hemorrhage is the most serious type of stroke with few treatment options. About 1 in 10 cases of stroke is an intracerebral hemorrhage, a condition caused by bleeding with the brain tissue with high risk of death and disability. This is the first study that examines the relationship between physical activity, acute stroke symptoms, and death after intracerebral hemorrhage. The results show that light physical activity such as taking a walk or cycling for at least 35 minutes per day markedly reduces the likelihood of severe symptoms and death after intracerebral hemorrhage, the researchers said. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.